Thank you. So she's a rheumatologist working in the Rheumatology Unit at Pisa University Hospital in Italy. Her long-term research experience is focused on SLE and connective tissue diseases, and her specific fields of interest are patient-reported outcomes, long-term outcomes, and pregnancy in lupus. She has a long-term clinical experience on systemic autoimmune diseases. Together with Professor Marta Mosca, she is the founder of the Lupus Clinic in Pisa and currently in charge of the pregnancy clinic. Now, we have a pre-recorded presentation on interactions with healthcare professionals, but luckily, we have the honor of having Professor Tani here with us today to answer any questions you might have after the presentation. So remember to post your questions in the chat. So you can run the presentation now.
Yes. Good afternoon, everyone. Thank you very much for the introduction. I'm really pleased to be with you today for this annual convention. Although virtually, I'm also honored to discuss with you about patient-doctor communication because I really think it's a crucial aspect of the healthcare process. In the next minutes, we talk about general concept of the patient-doctor communication. Then we will discuss about possible tips to establish an effective communication strategy. Lastly, I am pleased to present you some of the results came out from the Integrate project. Why talking about doctor-patient communication? Because an effective doctor-patient communication is crucial in building a successful therapeutic doctor-patient relationship. There are three main goals of the modern doctor-patient communication. The first one is, of course, facilitating exchange of information, but it's also important to create a good interpersonal relationship and including patients in decision-making. There are a lot of benefit for doctors from an effective doctor-patient communication. It includes an accurate diagnosis, a better identification of patient needs, perception and expectations, an enhancement in patient compliance to treatment plans, contributing to doctor clinical competence and increased job satisfaction. There are also several benefits for patients, including a better diagnosis and a tailored treatment plan, an easier comprehension of medical information, an increased patient satisfaction, and a reinforced positive view of patient health condition. And we also know that a good patient-doctor relationship has a positive impact on clinical outcomes. In this study, it has been observed that patient-doctor agreement about treatment and follow-up is strongly associated with better clinical outcome. And in particular, it is associated with, in this case, a better ability to tolerate pain, better recovery from illness, decreasing length of hospital stay, an increase in daily functioning, and an enhanced psychological adjustment and better mental health. However, studies on doctor-patient communication have demonstrated clearly that patient discontent, even when many doctors consider the communication adequate or even excellent. This is a very interesting study showing that doctors tend to overestimate their abilities in communication. And in this study, 70% of the orthopedic surgeons surveyed believe that they communicated satisfactorily with their patients. However, only 21% of the same patients reported satisfactory communication with their doctors. In general, patient surveys have consistently shown that they want better communication with their doctors. There are many barriers to good communication doctor-patient relationship, including doctor's burden of work, the deterioration of doctors' communication skills over time, unrealistic patient expectations, patient anxiety and fear, sometimes an improper setting of the consultation because of several interruptions, lack of privacy, for instance, lack of time, and the belief that some problems may not be related with the disease and therefore do not need to be shared with the physician. But beyond these aspects, there is a significant difference on how patients and clinicians view the disease. Patient and physician perspective diverge, and this is called communication gap. This is very important in chronic disease and especially in lupus. In systemic lupus, there is a gap between the patient and the physician view of the disease, leading to difficulties in coping with the disease, difficulties in disease management, adherence to therapy, and monitoring. This is because the routine patient assessment is based on the physician-driven instruments and indicators, such as disease activity indices and damage indices, as you know. And it is mainly focused on the clinical aspect of the disease. While this assessment tends to overlook several other aspects that are not properly captured by clinical indicators, but they have a significant impact on the patient's daily living. These include the quality of life burden, the social burden, the economic burden for the single patient and for the society, and the emotional burden. All these aspects are reflected in the patient perception and judgment of his own state of illness. There is a clear patient-clinician discordance in disease assessment, as demonstrated by several studies showing that the rate of discordance can range from 30 to 60% of these evaluations. And often this activity assessed by the patient is higher than that assessed by doctors. And physicians appear to place more emphasis on laboratory features, while patients place more emphasis on function, pain, and skin manifestation. This is a very interesting study in which patients and physicians were asked to complete a questionnaire regarding their concerns about specific disease manifestation and impact on quality of life. Patients' predominant concerns centered on function and fatigue, whereas physician concerns focused on SLE-related organ complications. The three highest ranked patient concerns were fatigue, pain, and feeling worn out, and they were routinely assessed by less than 50% of physicians. So items which were ranked highly by patients were not assessed consistently by physicians, highlighting a significant gap in healthcare communication. This is a study that you probably know very well. In this survey, fatigue was reported as the most frequent and bothersome symptom, followed by joint and muscle pain and photosensitivity. But most importantly, 1/3 of patients declare that the disease is not under control and reported a median of 9 symptoms. This data underline the presence of a great extent of disease manifestation and related issues that are not adequately addressed and treated with current therapeutic approach, highlighting several unmet needs from the patient perspective. If patients' physical, psychological, and practical concerns are not addressed properly, it can be a cause for interruptions in treatment and misunderstanding communication between patient and treating physician. Similarly, treatment goals and expectations are quite different for patients. And in this study, SLE patients were asked to select their top 3 treatment goals from a list of 8 options. Reducing fatigue, reducing pain, and reducing the frequency of severity of flare were the most common goals reported as very important. Goals that were of lesser importance included reducing or preventing long-term organ damage, reducing steroid use, and reducing immunosuppressant use. Interestingly, 60% of patients indicated that their physician's goal and their own goals matched not very closely or not at all. Moreover, more than half of participants indicated that healthcare provider had not asked them about their most important treatment goals over the past 3 months. How to bridge the gap and try to improve doctor-patient communication. From the doctor perspective, first of all, we should recognize the importance of how we communicate with our patients. We should improve our skills in communication and, if possible, train our ability. Then we should increase our practices in good communication, and we should work to have a more empathic approach to our patient. But something can be done also from the patient perspective. For instance, it is very important to be an active member of your healthcare team, to be ready to participate in the decision-making process by asking questions and be sure you understand, by preparing the visit in advance, by reporting symptoms in an accurate way, by being collaborative, and last but not least, trust your doctor. The modern concept of doctor-patient communication indeed and has progressively evolved into an open dialogue, transforming patient from passive recipient of information and instruction to active participants in the management of their disease. This is called patient empowerment, and it is very important for chronic disease, including lupus. A patient-centered approach is suitable in the management of chronic conditions such as the rheumatological diseases. And in the most recent recommendation for rheumatic disease released by Euler, one of the overarching principles is that treatment should be based on a shared decision process between the patient and the physician. What is the shared decision process? It puts emphasis on the patient talking and the physician listening and understanding the needs of the patient. The physician giving opinion and information, and the patient making choice together with the physician, and the patient asking and the physician answering. How can people living with lupus be better prepared for consultation? To be an active player of your process of care, you should prepare your consultation. There are some tips to use before, during, and after your medical appointment to make sure you get the best possible care. Before your appointment, remember to bring all the medicine you take to your appointment. These include prescription medicine, but also non-prescription medicine, vitamins, dietary or herbal supplements. And you should know very well your current medical conditions, past surgeries, and illnesses. During your appointment, it's very important to explain your symptoms very carefully, your health history, and any problems with medicine you have taken in the past. Let your doctor know if you are worried about being able to follow his instruction. And if your doctor recommends a treatment, please ask about the options. If you need a test, you could ask how the test is done, how it will feel, what you need to do to get ready for it, and how you will get the results. Then, if you need a prescription, tell your doctor if you are or would like to be pregnant, if you have reaction to medicine or take vitamins or herbal supplements. Ask for written instructions, brochures, videos, and website if available. And it can be very useful to bring a note sheet if necessary to take note of all these information. After your appointment, always follow your doctor's instructions. And if you don't know, if you don't understand your instruction after you get home, contact your doctor or nurse. Talk with your doctor before you stop taking any medicine and call your doctor if your symptoms get worse or if you have problems following the instruction. Don't do it by yourself. Sorry. Lastly, we already talked about the importance of asking questions to your doctors. Patients who ask questions and make sure they understand the answer tend to get more timely and accurately diagnosed and have better outcome. So you can prepare your question before the visit to be sure to ask at least the most important during the visit. Thus, I suggest to preparing a sheet like this to be ready for the appointment. The last topic that I would like to address with you is the Integrate project. Indeed, an appropriate doctor-patient communication integrates both patient and physician-centered approaches, and this is the starting point of the project. Integrate stands for integrating patient-reported outcomes, clinical data, and quality indicators to physician-driven data in clinical management of chronic rheumatic disease, the paradigm of systemic lupus erythematosus. This is an international project founded by the European Commission and University of Pisa and involving the Rheumatology Unit in Pisa, the Rheumatology Unit in Düsseldorf, and the Institute of Management of the Scuola Superiore Sant'Anna in Pisa. But for the realization of the project has been fundamental the active collaboration and support of Lupus Europe. The general objective of the study was to develop a strategy for the monitoring of SLE patients relying on the integration of patient-driven data to the traditional physician evaluation. The study work has been divided into 3 main steps. First of all, we perform a systematic literature review of existing clinical and non-clinical indicators for the management of systemic lupus and of currently available SLE-dedicated IT tools to support daily management of the disease. Based on the first results obtained from the literature review, ad hoc online surveys have been designed targeting European experts in the field of systemic lupus and lupus patients. The survey results have been discussed in dedicated focus group of patients and clinicians. The final step of the process was a mixed focus group designed to bring together not only patients and clinicians, but also general practitioners, nurses, and one caregiver. These are just some pictures representing the interactive work we done during the meetings in Pisa with open discussion and focus groups. The survey for patients was focused on the 4 main topics: knowledge of the disease and its management, needs related to the disease and its management, expectation toward the rheumatologist or clinician, patient knowledge, needs, and expectation related to possible ICT system to support the disease monitoring. These are very general data from the patient survey. As you can see here, we collect a lot of answers, not only from Europe, but also outside Europe from SLE patients. And this is the representation of the countries of patients that took part in the survey. As you can see here, there was a very great representation from Europe. Among the several results and aspects that came out from the analysis, patient and physician agreed on 4 aspects that should be reinforced to have a real integration between patient and clinician perspective. Thus, these are the points we should work on together in the next future. And to improve patient-doctor communication is the first point to be encouraged. But also we should encourage the organization of multidisciplinary teams to have a more holistic view of the patient, to encourage the self-management strategies, and to encourage, last but not least, a real patient education process. A very special thanks goes to all the patients who participated in the project, dedicating their precious time and energy to integrate. Thank you very much for listening, and I will be very happy to answer your question. Thank you.
Thank you so much, Chiara, for this wonderful presentation. I think it was very clear, and apparently we don't have any questions in the chat yet. So I don't know, Zoe, do you have any on Facebook?
We don't have any questions on Facebook.
You were so clear and concise that we have no questions. Well, I can think of one then. You mentioned several things you can do to help improve the communication between physicians and patients. So in your mind, what is the most important thing you can do as a patient to help the communication?
I think that, first of all, from the patient perspective, a preparation of the visit is crucial, because I can imagine that during the visit many sentiments can happen differently, fear and anxiety during the visit. So it can be very difficult to remember all the aspects that happened during the 6 months before the visit. Unfortunately, visits come usually every 3 to 6 months if the patient is going well. So it can be very difficult to remember all the aspects that happened in this very long time period. So my suggestion is to take note of the events when they happened in a note sheet, and then to report to the doctor. So I can have a picture more clear of what happened in the period, not just what happened yesterday, because we tend to remember what happened yesterday, but not the entire period. And sometimes when I ask patients, how do you feel? Well, yesterday I got flu. Oh no, it's a very important aspect, but I'm asking, how was your disease during the whole period? And it's very difficult to remember in this time. So prepare your visit, have notes, everything can be useful. Apps in your smartphone can be really useful to remember.
Yeah, especially about the smartphone. I always use that. I have my smartphone with me all the time, so whenever I think of something, I have a notebook I write it down on. So that's very valuable information. Yeah, and I tend, what I do personally is I take my list of things and I put it on the table between me and the physician. Yeah. The first thing I do, and tell the physician, I'm not leaving this room until we've spoken about my list.
Yeah, it's a good option, I think. Yeah.
So we have a question from Sean, who asks, how will you measure success with the Integrate study?
Sorry?
How will you measure success with the Integrate study? So what will show that it's a successful study?
First of all, the participation of patients and physicians was excellent. We asked, it's in a very difficult period, we collected several patients and several physicians in the same room in a little city like Pisa. So we had a very great enthusiasm. Participants were really engaged in the project, and this is, in my opinion, the first result of the project. So enthusiasm, engagement, and the final. This is a real preparative study. So we prepared the contents of an instrument, an ICT tool, something similar to be used in our clinical practice. So with this study, we prepared the background. We received inputs from physicians and from patients, trying to merge together the inputs. And I should recognize that for some aspect, we cannot integrate the two perspectives. In some aspects, it can be very difficult, probably impossible. But for the majority of the aspects, we can really integrate, put together the different vision in a unique way to follow our patient.
So the work isn't really over yet. It's a continuous going on, and
just the starting point, just a first project to prepare something bigger.
Yeah, sounds good. So I really like Inya's comment, because she says the communication for me also should be available out of the appointment. Life happens in between. So how do you feel about the connection? How do we connect patients and physicians outside of their regular visits?
This is a very good point, and we discussed a lot in the Integrate focus group about this topic. And of course, we try to, for instance, in our clinic, we are trying to set up some way of communication, emails and dedicated phone call is always available. But of course, it's not possible for a doctor to be reached every time, every day, because we have some periods of...
Yeah, you need a private life as well.
So we have a dedicated phone number for our patients, and usually the nurse is answering the phone. This is really in the pilot project. This is a very first time used in a pregnancy clinic, where the contact between physician and patient is really important every day. So we have set up a dedicated phone number, and we are going to expand this initiative to all the lupus clinic. The other point is a dedicated email address, where patient can refer for non-urgent needs. Sometimes that can be answered in a few days. Yeah. But it is an issue. I recognize that this is an issue. And not in this time, we have not a direct connection with our patient.
No. So, yeah. So actually, you already answered one of Amy's questions. So Amy's questions was, have you considered wearables for this connection, or a lupus nurse? So you are using nurses as a sort of filter to get some answers to questions right now. But what about wearables? What about watches or things that people can have on their bodies, which might alert you to something going on?
They can be very, very useful in our practice. We ran a project last year about with a wearable device that follow up the activity, physical activity and sleep of the patient. And indeed, we collected a lot of real-time data about these aspects. So I really feel that wearable devices can be useful and integrated in the our ideal solution, IT solution. Yeah. Mm-hmm. So the ideal IT solution should include wearable devices to collect some real-time information that otherwise will be lost. Yeah.
Mm-hmm. Susan has raised her hand. Susan? Please unmute yourself.
Yes. Hi. Thanks for that presentation. I would agree with everything that you've said so far, I think. I've been a lupus patient for a long time and seen many different physicians, but I was also a primary care physician myself. And just from my own experience, I know that I used to see patients coming back from hospital consultations asking me to explain in more detail what had gone on to them. And that was often very difficult because of lack of communication from the secondary care physicians. And I wondered if you'd sort of thought of that as part of this project, because it would facilitate the doctor-patient communication in primary care if there's more information coming out from secondary care and make the patient's experience better in that sense. So I wonder if you have looked at that aspect of things.
Yeah, I completely agree, because the primary care is the very first step for the patient. So it should be very well linked with the specialist. And in Pisa, we are trying to prepare this kind of connection with an app, then where primary care physician and specialist can go into the patient chart to exchange take information and input data, so everyone can see how happened in the past. So it is a very important issue where we should work on, because it's fundamental, because it can really increase the quality of care, because it can assure continuity between general practitioner and specialist and patient. Creating a very important link.
Yeah, thank you.
Thank you for a great question, Susan. Very relevant. So Zoe, do we have any questions from the Facebook? What would you advise as tips to shift the focus of the conversation with doctors? Sometimes doctors are very focused on blood and imaging results, test results, quite rightly so, but we as patients may be focused on life and everyday function. How can we shift the conversation with doctors in consultations to discuss function? Sometimes doctors move on quite quickly when we try to bring up such issues.
I agree with you. This is a point that I raised in my presentation, because I have to admit that physicians have very little experience on communication. We do not have communication skill. So you as a patient should try to shift the conversation by asking your doubts, by asking your doctors about the things that really matter for you. So you can you can overcome the limits of your doctor by soliciting some answers from yourself. So ask your doctors, pose questions, pose doubts, and if it's not possible during a visit, because this visit particularly busy, can happen, try to have some answers the next visit if possible. So because I can imagine that every time there can be some problem, logistics problems, or a few times, or some other urgency that needs attention, the doctor attention, but sometimes not. So try to find a way to open a window in your relationship with your doctor. So ask question.
Be insistent. Yeah. Ines, you had your hand up. Remember to unmute yourself. Yeah. Go ahead.
I just want to say that I have along the years all kind of relationship with the main physician. Okay, I'm not talking about the other. And every time that I change because they change places, and normally I cannot change hospital as easier as they change. And it's very hard to change doctors every time I change it here. And the first consultation, I came out with the urge of crying and shout. I was very angry with him because I had a great relationship with the one before that take out all my anxiety of life. Life happens. You have something and you have to add, or you have to transform your therapeutic, or if you have something on the lungs or sexual or something, you have to change, you have to address him because he's the main one. It's not the other ones that introduce the things. He is the one who says yes or no, or wait, or take this out, do this or do that. And For me, this is very, very important. And sometimes, even if I have a list and I'm very organized, there are things that got lost for the fog, for the tiredness, for life that's it's doing something for them that are not available. The first one, there were 3 guys, 3 male doctors, 2 in training and this guy. And I tried to introduce myself, tell them what kind of a patient I was, like make the basis rules for me and also for them. And it was very bad received. Very, very received. I was mocked by them, especially by one of them. It wasn't nice. Then for some period, I didn't have some of the medicine. I didn't have a family doctor. And also he didn't answer on the mail, the generic mail. So suddenly I had no nets. And I had to ask around between my doctor friends. This is not nice. I'm not supposed to do this with my friends. I am supposed to focus on that doctor. So yes, the appointments, yes, to organization, but life happens in between. And it's very, very hard not to be, sorry to say this, a pain in the ass to you, and try not to be anxious and not to be this kind of annoyed patients. Even we don't want to be that.
No.
We want a straight relationship. We don't want to be a burden. But even if I want comments to control the meeting, the appointment, sometimes they don't like that.
No.
It seems like I'm overstepped.
A nuisance, yeah.
Yeah. So this is always a balance. We have to meet 3 or 4 times to understand each other, to not step on each other.
Yeah.
And sometimes we are not also well, and we are not friendly.
Exactly.
And the first impression is so important. And I'll shut up. Sorry. I'm just saying that I have all kinds of relationships along years, and it's hard to restart, and it's hard not to have not a plan. I'm not saying that, but the rules more clear to what is my rights, what are your rights, what are my duties, and what's your duties.
So some kind of guideline on how to communicate. Yeah. And actually, that brings me to, thank you, Ines. That brings me to Blanca's comment about maybe putting a psychologist in the middle to sort of solve that issue between physician and patient. How do you feel about that, Chiara?
I think that a multidisciplinary team is essential to follow patients with lupus, because we should be rheumatologists, nephrologists, psychologists, gynecologists, physical therapists. Every specialist can be involved in the team, because there are so many aspects that should address that I'm not able to do everything, because I have no time, I have no experience, I'm not a specialist in other fields.
Yeah.
So I think that the rheumatologist is the main player, of course, but it's very important that lupus clinics are organized with a multidisciplinary teams, because also it is important that I agree that you as patient would like to have every time the same people who talk with, the same doctor, the same people, because you create a relationship over time. But as we are organized in Italy, but also in Europe, it's very difficult to provide such a constant relationship. So it's very important that the teams, the lupus clinic, have a team of people who are going in the same way, with the same methods. So you, Jeanette, can see today Chiara, last day Marta, next day Elena, and every time you receive the same approach. This is reassuring for the patient, although you cannot see every time Marta, because you started with Marta and okay, but you can see Chiara and Elena, they are the same. They can provide the same quality of care, the same approach, the same feeling also. This is important. This is what we should try to do as doctors, together with nurses, because they are really important in the team, and as psychologists. Unfortunately, in Italy, we don't have a structured way of having a psychologist in our clinic, but we are working on that because it's really important.
You're still far ahead of many other countries who don't have lupus clinics like you do, where you actually have the different, the multidisciplinary team that you do have today. So that's really an aspiration, a goal for the rest of us. Thank you so much, Chiara. Unfortunately, we don't have any more time, but I think it's really, really interesting, and you really have opened up a very big box of questions. And how do we solve this? We need to work together to solve this issue. So thank you so much.
Thank you. Pleased to be here.